Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
A couple of things in the Washington Post that were of particular interest. Of course, one that is something we've been discussing for the last couple of years is the widespread use of plastic, which puts harmful chemicals in nearly everyone's diet. And it's finally gotten to the point where it's the front page of the Washington Post, and they have a complete page section talking about plastics and the number of compounds that derive therefrom, which can be carcinogenic and otherwise harmful. And of course, the biggest problem is that it's in everyone's if everyone is tested for it in their body and their blood, they will be found to be positive because it's almost impossible to escape the plastic containing materials because the food is packaged in it, the water bottles are plastic, and it goes on and on. And one of the things that is most impressive about all of these articles about plastic and the plastic forever chemicals is that there's very little that is said about how do you counteract having all these plastics in your bloodstream. There's an article that we discussed today about the having it in the water and how it affects infants and children. But the fact is that almost everybody on the planet is positive for plastics because it's in everything and almost everybody. And while much is said about the problem of the plastics, very little is said about what you can do to prevent it from occurring or after it's occurred to keep it from harming you. And that's the part of the story that remains untouched. What we're going to do about it, yeah. And all of the articles talk about how dangerous they are, but none of them really talk about a way of eliminating contact with plastics because it's in almost everything, even in the soil. So anyway, any comments about the plastic forever chemicals that are contaminating just about all human beings?
Yeah, good morning, everyone. Yeah, I've done a little bit of research over the past maybe 10 years about plastic in the ocean. And we do river cleanups over in PG County and also in Rock Creek Park, where we collect plastic. And, they found that, billions, literally billions of tons of plastic get dumped into the ocean. I mean, we think the ocean is so big, but that plastic goes in the ocean. Fish eat the plastic, and then we eat the fish. And there's hardly anything we can do about it except stop putting plastic in the ocean. So it's a very difficult situation, as far as what to do after we get it. I think we're stuck. Thanks.
Any other comments about this problem that is ever increasing? Well, I think that putting more attention on these forever chemicals will help us to try to figure out some way to overcome something that is already present in almost every human being on the planet.
What about
thought I'd bring it to your attention. Any other comments?
What about a vaccine?
Yeah. What about it? I mean, we don't have anything yet.
Maybe they could develop a vaccine for people
Well,
who to protect against plastics.
oh, okay. Well, since since virtually everybody on the planet is already exposed, it would be important to do something like that. But so far, nothing seems to be contemplated. But any other comments on this so far unsolvable problem? Uh, the next article that I thought was interesting is an article that a pediatrician has written on the do's and don'ts of giving gifts to children since we're in the holiday season and Christmas is thought of as a season of giving rather than receiving. And we're always giving to our children. Uh, they have about six do's and don'ts of giving gifts to children, and I'll share them with you. One is be sure you're aware of the technology that is involved with whatever gift that you give to your kids, because some of these gifts have parts of them that are disposable and can be swallowed and be harmful to kids. So research technology, whatever gift you give to your kid, to be sure that it's not going to be harmful, which isn't as easy as it may sound, because some of the technological aspects of some of the gifts may be difficult to figure out. Saying the second thing that they mentioned is to uh, be realistic about your expectations. That some gifts take a while for kids to adjust to, and some uh, they never really adjust to. And the thing to do is to be realistic about it. And if they enjoy it, wonderful. If they don't, let them go to the other gifts, because very few children have less than five gifts. So uh, be patient with expectations about whatever you give your children. Then third, they say uh, if the gift is very expensive or maybe even inappropriate, have a discussion with the child about it and discuss the virtues and values of the positives and negatives of the gift so that the kid would put it into perspective. Yeah. So uh, if other kids are having special presents and your kid isn't, try to help them understand why you've given them the gifts that you have or haven't. And I think communication is one of the best things you can do with whatever gift you give your children.
Yeah.
So they can get in.
Can't get anywhere.
Zoom.
Okay.
The next
I'll work on it.
the next one is don't be bound by what the children already has and knows about gifts. And put things into perspective. Sometimes your kids will get gifts from people that you didn't expect. Sometimes they get books that are inappropriate, and sometimes they get gifts that are really great. And put it into perspective with the child and have a discussion about it so that it's something that both of you can enjoy together. And then one of the last things they say is don't worry about spoiling kids with gifts, but do teach them about gratitude and tradition so that they can be appreciative for whatever gifts they have, and also understand that it's in the giving that is what makes Christmas so special. It's the gift of giving. And the greatest gift, of course, is the gift of love. And sometimes we try to express our love for them by our gifts, but recognizing that it's in giving that we receive that is maybe the most important gift of all. Anyway, those are the thoughts I'd share with you that the Washington Post has included as we give gifts to our children, grandchildren, and great-grandchildren. Any comments or thoughts about either of those two articles? If not, I guess we can go in to start with the 21 articles that John has put together.
Did it get in?
I think so.
What's the number? Because my computer went off and I have to start over again.
John Tatum, you're not muted.
Oh, okay, working on it.
This first article is on faith in medicine and demonstrating that those people who actually practice religion and have spirituality seem to do better with most diseases, including cancer. And while medicine rarely actually asks people about their faith and their religious beliefs, it is evident from this article and many others that I've read that those people who have faith and who see uh, religious observances in their physicians are better off because of that. And so faith, spirituality, and religiosity plays a role in the healing process. So it's very important to recognize that we have healthcare providers gifted by God to heal things, but it's really we put the tissues together, but it's the power from above that it really heals things. And those people who believe that there is a power above, it helps their healing process. So that it's something that many studies have demonstrated, as this article points out, that those people who have beliefs heal better and faster than those people who don't. And cancer is one of the diseases where it is most powerfully evident. Any comments? Of course, I think all of us who have faith have seen the healing of people who people felt could not be healed. And so we know the power of above. But any comments about your experience with faith and spirituality and religion in the healing process? No comment? Well, I know my most uh, famous observation was that I remember when we started doing liver transplants, we had a liver patient who uh, had uh, such bad hepatitis that he was in coma, and he was so sick that we felt that there wasn't really much we could do to help him. He was a young man. He was younger than 40 and had viral hepatitis. And when viral hepatitis gets to the stage where the brain is is damaging you in coma. The medication we can use, but when the virus is all over the body and you're virtually brain dead, we'll get to the point of hopelessness. And in this young man, we recognized that we'd done everything we could and felt that he was hopeless. And it was interesting because his church people came to visit him and they anointed him with oil and laid hands upon him. Uh, and as we recognized that he was unsalvageable, and as we discontinued our efforts to try to save his life, step by step and day by day, he got better and he actually walked out of the hospital. And a couple of weeks later, I met him on the subway, and he talked about the fact that he had recovered completely and all is well. And of course, we had done nothing to get him well. This was all as a consequence of the anointing him with oil and actually praying for his recovery. So that's just one example that I have of the fact that we do the best that we can and we put tissues together, but the healing comes from above. Any other comments, Darryl? See you.
Yeah, my comment would be that when dealing with illness, you deal with it better if you have a firm foundation, and religion can give you that foundation. Without that foundation, the problem, I think, is fear of your outcome, and that can trigger the body's stress hormone, leading to release of hormones and uh, that activate the immune system and cause inflammation. And so that can contribute to whatever illness you have, you're going to get worse if your body is inflamed. So, whatever your psychology is, if it's giving you a firm foundation where you're not as susceptible to fear, that's a good thing in the healing process.
Thank you for sharing, Darryl. Joyce?
Yes, I think I've shared this story once before. My brother had his appendix to erupt on him, and they took him down to surgery, and his stomach cavity was filled with infection from the eruption. Once they finished the surgery, they brought him back upstairs to his room, but they told us that because of the seriousness, they chose not to close him back up because they did not see that he would be here for the next day. My mother went home and she got her prayer warriors on the phone, and we prayed and we prayed and we prayed. The next morning, we got a call from the hospital and they said that his condition had changed. They're taking him back down to surgery, and they will be stitching him up and bringing him back. We went back to see him that afternoon, and his eyes were good, his spirits were good, and everything was good. So, yes, I believe in prayer. And that's just one example of how prayer can heal, or the effects from prayer can be a healing substance for the body.
Thank you for sharing. Any other
I just wanted to say to Joyce, I remember it so vividly. And when she said they took him back upstairs, fifth floor, east wing, and his buddy next door was right next door to him. And I remember they left James open, and he had come through a lot. He was a very strong person. And of course, family support, it means a whole lot. But I truly remember that day.
any other comments, any other sharing? If not,
Mhm.
Thank you for sharing. Okay, let's go to the next article then. This is actually old news. A low protein diet to improve chronic kidney disease is something that people kind of forgot about, but it's something that was always part and parcel of, treating kidney disease because when you have a kidney disease, the BUN and creatinine are elevated, and uh, taking protein increases the BUN and the creatinine. And so one of the ways to decrease this is to decrease the amount of protein intake. uh, the two diseases for which that one is kidney disease, the other is liver disease. That protein intake is associated with a bad outcome. So they put people on low sodium as well as low protein diets for kidney and liver disease. Uh, and so uh, many studies now have demonstrated that yes, the low protein diet does reduce the progression of kidney failure. This, of course, becomes more important for those people who have kidney disease who are not on dialysis uh, and so for them it's even more important than those people who are on dialysis where the kidney machine is taking off many of the poisons or toxins. John Buchanan?
Yes, a couple things. You know, it seems that I've heard recently that protein is very important, especially if you're on a vegetarian diet or non meat diet. It's important to make sure you get enough protein. And I think this article is talking about having uh, over overabundance of protein in your diet. But I was wondering, you mentioned the BUN. I've seen that on my blood test. I never knew what that was. Didn't bother to look it up. Can you tell me what that is? BUN?
Yeah, blood urea nitrogen is a product of breakdown of protein, and the normal BUN is usually less than 20. And so uh, if you have a high BUN, that means the kidney is not clearing uh, the breakdown products of protein metabolism. And so the uh, closer you are to above 20, the more likely it is your kidney is not functioning 100%. So that's what the blood urea nitrogen is. That along with the creatinine is thought to be the most uh, critical of the two. Of course, the creatinine, the level is 1 that you look for or below, whereas for the B1, it's 20 or above. That becomes toxic. So both of those are a consequence of the breakdown of protein in the body. Uh, so that the kidney is responsible for eliminating uh, the breakdown of the protein products, which is the BUN and creatinine. Does that clarify for you at all?
Thank you.
Okay. All right. Let's go to the next article then. This is an article that is characterized with only consuming healthy foods. And it's interesting that it's considered pathological, but it can be that you get so focused on eating healthy foods that you leave uh, leave some foods that are nutritional out of equation. And so when you become obsessed with it, meaning that you will only eat those things that are healthy for you, and to exclusion of everything else. It's interesting that they do not identify a particular person who has this mental disorder, because I've not encountered it, but it is a mental disorder that does exist. I've never encountered those people who are so concerned about eating healthy foods that they eliminate, they actually have poor nutrition as a consequence. This is different from anorexia, where you don't eat at all. But this is where you're obsessed with only eating that which is healthy food for you, and to the exclusion of everything else. And I've not encountered this particular disease entity, but uh, but it is a mental disorder that exists. I don't know, have any of you encountered anybody with this particular obsession with healthy foods to the exclusion of everything else? Well, I'm sure that nutritionists may have the opportunity, and maybe some psychiatrists and psychologists, but it's not a very common problem. And the problem is most people are not eating healthy enough foods. So it's not. We wish we'd have more people who were focused on healthy eating, but this is a problem to the extreme that I've not encountered. Any of you have any experience with any patients who fit into this category? But anyway, it does exist, but I've not seen it. So. And I think what happens is that they miss some of the elements that are necessary, magnesium and phosphorus and other things that are important in order to stay healthy, because of the obsession with certain healthy foods, that they eliminate some of those key elements that, particularly the magnesium, the phosphorus, and other elements that sometimes we don't think of, like zinc and other things like that. Any questions about this rare phenomenon, where the focus on an obsession of eating healthy foods to the exclusion of all other foods? Any comments or questions about this? I don't see any hands. So. Okay, let's go to the next article. The downsides of drinking orange juice every day. This is something that most people don't think about, but the problem with orange juice is not the orange juice itself, but the sugar that's in the orange juice. And orange juice is good. It's uh, the fact that they have so much sugar in orange juice that makes it a problem. And this is so oranges are good, but orange juice is not. At least, if you had maybe just a cup of orange juice a day, that probably wouldn't be too bad. But if you Drink a lot of orange juice every day, then the amount of sugar in the orange juice would be the problem. The pulp is good for you because it gives you fiber and it's wonderful, but it's all that sugar that they put in there that is problematic. So your orange juice lovers, just remember that a lot of sugar in it. Janice, you're on mute.
Yes, I am that orange juice lover. Again, this is one of those topics we discussed before, and you told me do not drink that orange juice every day like that. And instead of drinking the whole bottle, I might have just a couple of ounces each day just to take my medication with. But I've definitely reduced it. I do not drink the whole bottle every day. I
Thank you
love
for
cold orange juice, but
sharing.
I've reduced it. Yes.
Thank you for sharing. Any other comments? If not, let's go to the
Yeah,
next.
I was going to ask Janice, do you have the orange juice with fiber, with the pulp?
I used to with pulp. Now I focus on my vitamin D. So this is with calcium and vitamin D.
Okay.
Okay. I changed it's always Tropicana. Everyone, see. But but I need the vitamin D and the calcium. So I do that more so than the pulp. I used to do uh, I think it was low pulp or something like that. But now I get the calcium with vitamin D.
Right.
Just a few ounces.
Okay. Any other comments or questions?
Yeah, my comment would be that when you get orange juice with the pulp, it's never going to have as much fiber as with the orange. And the
Right.
fiber is important because it slows down the absorption of the sugar. And an orange is a high sugar fruit, so you need the total fiber of the orange. Just the pulp that they add isn't enough.
Thank you for sharing. Thank you. Okay, let's go to the next one. Measles is still with us. This is interesting. South Carolina, along with Utah and Arizona, they're quarantined because of measles, which is a disease that had gone out of existence. And so Utah has 115 cases, Arizona has 176. So this is interesting for a disease that is eliminated since 2000 as a result of routine childhood vaccinations. So Canada lost their designation last year, and looks like we're next. So, um, and of course, measles is a tough disease. It's very contagious and can be lethal. But vaccination actually had eliminated it. But anyway, it's a new day. People are fearful, more fearful of vaccinations, and some of the diseases that we eliminated are coming back. Hmm.
I had a quick question, Dr. Calendar. If we
Yes,
were vaccinated as children, we're safe?
yes.
Okay.
If you had 2 doses, you're almost 100% protection.
Thanks for that.
Okay, let's go to
My
the next.
sister Carol tells me that we were both vaccinated against measles as kids, but I don't remember. So there's a MMR vaccine for measles, mumps, and rubella, and I'm reading that uh, if you get an extra dose as an adult, it doesn't hurt. It doesn't. It's okay to get an extra dose if you don't remember originally getting the vaccine.
Thanks for sharing that. Okay. Let's go to the next article. This is something we've talked about for some time. That when you're over 65, you need to get a double dose. And this article goes into detail to emphasize that the double dose makes a difference, and that if you're over 60, uh, since your immune system is waning, it makes a big difference to get the double dose. So those of you who are over 65, insist upon getting the double dose. If you don't get it, go back and get it, because flu is not fun. So, and of course, the flu is lethal, particularly for those of us over 65. Yeah, there are side effects of the uh, injection pain, side fatigue, and small and headache. Most have little little side effects from the vaccine. Any comments? I think this is something we've talked about for years, but it's just I thought it'd be good to that you have an article that authenticates the importance of the uh, need for a double dose when you're over 65, that it does make a difference. This article goes to great detail uh, to emphasize the merits of the double dose.
Yes, Dr. Counter, what does adjuvanted mean?
It means that it's hyped up. In other words, it's more than usual. Right. That's what adjuvanted means. Yeah. It's, things are added to it that make it more concentrated. Yeah. Enhance is one way of putting it, but adjuvanted is even more so. Okay, let's go to the next article. This is an article that responded to some people who thought that there was an increased use of Parkinson's disease in when you take flu vaccine, but most of the studies that have been done show that there's not an increased risk in with Parkinson's disease. Just as there was a concern about autism, which has been dispelled by many studies, the same thing is true for Parkinson's. And they've done enough studies, talking about the millions who received Parkinson's, received flu vaccine. So this was one of the reasons why some people didn't want to take the flu vaccine. But so far, there's no evidence that this is the case. So reassuring for those who were hesitant about taking the flu vaccine. Next article, let's go to. This is something that is frightening a bit because we've talked about the Nova virus, and the thing about the norovirus is that it's one that the alcohol doesn't help you with, and it's uh, you get it through your poop and hand to anal contamination, and the hand washing does not help with that. You got to get soap and water to really knock out the virus, but the hand washing and alcohol does not touch the virus. So it's spread through food and hand to anal And so keep in mind, I would say again, hand sanitizer doesn't kill the virus. So hand washing is crucial for the norovirus, which is associated with diarrhea, the leading cause of diarrhea and vomiting when you get a virus. You get diarrhea and vomiting. This is the virus that is usually responsible for that. And emphasize the importance of hand washing, soap and water, good old soap and water. Hand sanitizer doesn't do the trick. So keep this in mind. If you see somebody vomiting and diarrhea, you know the norovirus, which is a common virus, which is actually intensified during the season so far. So they're warning us about it. Norovirus. We talked about it before, but this season, for some reason, it's flaring itself up more than ever. Fluids, fluids, fluids. That's the important thing. Stay home. Uh, take plenty of fluids. And then if you're not getting better, you need to go see your doctor. Because nothing like losing fluids with vomiting and diarrhea. It'll kill you if you don't get it replaced. Any comments? If not, we can go to the next article, but keep that in mind. RSV is a vaccine that now is present, and just for the last 2 years. This is a virus that it focuses, it hurts older people, people older than 60. Respiratory syncytial virus, we now have a vaccine for it that works, particularly in those people who have cardiovascular disease, diabetes, or respiratory tract infections. In people over 65, it is far more lethal than we would like it to be. The good news is that we now have a vaccine that lasts at least a year, and probably after a year or two, it may need to be vaccinated again, but it's at least a year or two. One of the concerns is that not as many people as desired who are over 65 are getting the RSV vaccine. And as a consequence, there are people who are dying who wouldn't otherwise die because of the lack of taking the vaccine. Any other comments or questions about this? So the flu and the RSV vaccine and the COVID vaccine, if you're over 65, you ought to have all three of those. Any other comments or questions about, as they talk about heart disease, diabetes, renal disease, liver disease, are RSV risk factors? As well as anybody who's is immunosuppressed for any reason. Okay, let's go to the next article. Hope everyone is vaccinated. Now, FDA investigating whether adults' deaths are linked to coronavirus vaccine is something that you got to do anyway. So, why is an article about that? I don't know. Just that should be done. That kind of investigation should be done for adults and children, because we need to know the life-saving benefits as well as the consequences that we are subjected to with this vaccine. To what extent uh, have people had morbidity and mortality as a consequence of it? Because that's something that should be known. So that's part of the FDA responsibility and accountability.
Dr. Calendar, you talked about these three vaccines, flu, double dose, RSV, and the other one.
COVID.
Yeah. Are masks still helping?
Masks always help. Yeah, masks are always helpful. Uh, Hands sanitizing and masking are good things to practice regardless. Though some may look at you strange, it's still beneficial. So we await studies that will manifest because the problem with everything is that in the short term, we know what happens, but in the long term, sometimes we don't know all of the things that could be happening later on. And so it's important to look at it the first year and also 5 and 10 years thereafter. So we know the real uh, price you pay for all of these new developments. Same thing is true for the GLP-1 drugs. The early results are great, but we need to know the middle and late consequences of these drugs as well. Okay, let's go to the next article.
Dr. Calendar. Good
Yes.
morning, everybody. This is Sylvia. I guess I was just thinking, in light of the current secretary who's in charge of Health and Human Services, that the FDA will probably find more individuals dying from the COVID vaccination than normal, because you have an individual who's against vaccines, and he's in charge of I guess the FDA. Why would they not find more individuals dying from COVID?
The data should speak for itself, regardless of who in charge runs the FDA. The data is what matters, not who's in charge of running the data. If the
Now,
data is pure, then the consequences of the data analysis should be free from politics.
I would be thinking hopefully it'll be free from manipulation also.
Yeah, that's exactly right. And
Mm-hmm.
that's the hope and expectation that in spite of his inexperience, that he would just let the data speak for itself. Just as it has so far spoken for the autism issue. Okay, let's go to the next article. This is looking back at the COVID vaccine reduced children's likelihood of emergency room and urgent care visits as the CDC looked back at it. And that this is not a surprise, but and I think that's what the data is all about, to look back and learn from what the data tells us, not to manipulate the data in the way you want it to work, but to use the data to analyze things and make changes according to what the data manifests itself. However, you have his perspective here. So, but the data is what matters, not his opinion on the data. Okay, any comments? Or if not, let's go to the next article. Well, this is yeah. The World Health Organization reaffirms that there's no link between the vaccines and autism, which uh, Kennedy and others had claimed. But yeah, yeah, anyway, no, this is a political situation, and it should be free from politics, but obviously it isn't, and that's the point you were making, Sylvia. And we should, at all costs, look at the data and let the data speak for itself. But we shall see what we shall see. Well, this is the same article. In spite of what it says, the data is clear that autism and vaccines are not related. Uh, so, and it's interesting. The guy who was up for the Heisman Award, mm, Jones, I think his name is, he may well be a person who has a part of the spectrum of autism. So autism can make you a genius, or it can affect you in a way in which you can't relate to others. It's this wide spectrum of the autism uh, situation. And for some people, it gives them a tremendous advantage, and for others, a tremendous disadvantage. But be that as it may, there's no evidence that vaccines cause autism.
Dr. Calendar, has Kennedy retracted his statements about that?
No,
Mm, okay.
they're not based on any data anyway. So, but
Mm,
he has not retracted any statement.
mm.
As a matter of fact, he made efforts to try to retract or eliminate studies that demonstrated that vaccines and autism were not related. But he has made no change in this. Neither has Trump.
Beautiful.
Uh, Gaslighting is where you make an allegation that is not necessarily proved by fact. And Lyme disease, as you know, is a disease that's related to tick bites. And we don't know all there is to know about Lyme's disease, but it is a disease that is common, too common, and requires us to time and time again get evidence about it. I don't know what these pictures are for, but anyway. Uh, we do know that Lyme disease is related to ticks, and that has been difficult to diagnose as well as treating. Yeah. Uh, we don't know any connection between Lyme disease and vaccines or autism. So, Lyme disease is something that is the cause for many problems, and it's thought to be tick related rather than anything else. But it's worth studying. You don't see too much of it around here, but it is ever present. But it requires the team to look for it. We have diagnostic tests that can confirm the presence or absence of Lyme disease. So we have the test that can identify it and also have treatment for it.
Yes, Dr. Calendar. Um, I've heard, I guess it's rumors, I haven't read anything about it, that people with Lyme disease have it for ages, for years and years and years, and they can't get rid of it. Have you ever heard that?
No, because it's treatable. We know how to treat it. You have to make the diagnosis. Now it's gone, a number of people have had it and they have not gotten it diagnosed properly, but there is a treatment for it and it's treatable disease. We know how to make the diagnosis of it, but you got to think about it and order the blood test to make the diagnosis, but it is treatable and it's curable.
Have you heard anything about hyperbaric chambers used to
Not for
treat
Lyme disease, no.
Lyme?
No, I haven't. They have antibiotics that they use for it. But I just haven't heard of using hyperbaric chambers for Lyme disease. Any other comments about Lyme disease? It's interesting that we talk about many things, but this study points out the importance of just following up with your patients as being the top issue for good care, so that you see your patients and after you treat them, follow up with them and make sure that they're better, which is very simple. But often patients get lost to follow up, particularly if they're homeless or they don't have health insurance. And of course, this is something that the Democrats waged war. They got the shutdown, but still nothing has been done. And with Obamacare, the number of people who were uninsured dropped considerably. And if you don't have health insurance, the likelihood of you being followed up is poor. And that's the number one barrier to valued care is the follow up. And so when you're taking care of patients who are homeless and have no health insurance, uh, you don't get the follow up, and therefore the care is compromised. And to me, that is the number one issue. As we see patients often who have no primary care doctor, and they cannot follow up in the clinics. These people are going to get sick again with some of the same issues they had before because they're not properly followed up. And this is the top barrier to value care. And that's why the United States lags behind all of the countries that because they don't have universal health care. So healthcare is not a right for all Americans. And that is a huge obstacle to health care. And so when push comes to shove, that is something that I guess we've talked about ad nauseum, but it's still the number one issue for the United States. And it manifests itself in a number of ways, but it's still the number one problem, I think. Any comments about the value-based care and If you don't follow up, how can you know whether or not you've made a difference in treating somebody? Interesting. There's so many studies now that are manifesting the ways in which Obamacare has contributed to the good health and to the decreased uh, mortality and morbidity rates associated with many diseases, as a consequence of health insurance now being available to some. But yet the drive for the Republicans is to eliminate Obamacare, which to me is unethical. Any other comments on this statement? Of course, Darryl has said the cure for this is to go to a country that has healthcare, universal healthcare. And that's right. Yeah. That's easier said than done for some. Any other comments or questions about this? If not, let's go to the next article. This is interesting that the suicide rate fell in 2024, and we don't really know why. Whether it's just a once in a lifetime experience, or is it related to the new suicide line? Is it related to is it happenstance, or is it related to the fact that we have more agencies that are looking at suicide? One of the things that has been decreased, as you see in this article, is that Trump has eliminated an agency that was singling out LGBTQ community because they had the highest suicide rate in the country. And Trump's administration has eliminated that. So if that contributed to it or not, we don't know. But we do know that the LGBTQ community had the highest suicide rate in the country. And so it merited having a special unit that looked at, in particular, the suicide rate in the LGBTQ community. Other than that, whether or not that's going to make a difference, time will tell. Any other thoughts as suicide, of course, was at one point a condition that was rare in the African American community, but we're catching up with the Caucasian population. Any comments about the suicide rate and what we can do?
My comment would be, although it's great that the rate is declining, that it's still the nation's 10th leading cause of death in 2024. So, whatever mental health issues that we have in the country, they're still pretty high.
Thank you for pointing that out.
I was going to comment almost the same way and say something to the effect that uh, they've changed the category. I mean, the depression has come into play a lot more. And depression is treatable with drugs and with therapy. And that may have helped take the suicide rate down some.
Any other comments? Thank you. Any other comments? But we certainly need to do more and more. So, okay.
Let's see. Yeah, my comment, I was always concerned and surprised about the suicide rate for youth and young adults. So we're talking about ages 10 to 24. And that's still the second leading cause of death for youth and young adults. So that's really a crisis for that age group.
So true. So true. And so we should not uh, rejoice yet. We got a long way to go. Although this next article that first at home device for depression, where they put this brain stimulation device, and it is supposed to decrease the amount of depression. As so far, I haven't seen any data that shows. We do know that the depression rates have surged, but we don't know to what extent this device is going to help that. But it's available now. $500 and $800. It's a small price to pay for if it would help. The question is, 58% of patients receive remission after 10 weeks. Yeah. So it's suggestive, so time will tell. We need to have more studies of it, though, I think. Any other comments on suicide, depression, and this new device? Here again, we need to have a short and long-term view about what is the consequences. Used a lot in Europe, but not here in the United States. So we'll keep our eyes open for studies. Tell us about the impact of this new device. Okay, let's go to the next article. This is an article that again is maybe premature as well, but the drug may reduce the risk for cataracts and AMD, which is dry macular, age-related macular degeneration, which GLP-1 drugs may reduce, but I think we need to have more long-term studies. But the early evidence suggests that this may be the case. But my feeling is that it's too soon to tell. But the fact is that all of the GLP-1 drugs are anti-inflammatory. And so the fact that these drugs are effective against inflammation is why they work for so many different organ systems. Since age-related macular degeneration is something that we as elderly face as a cause of blindness, it's important, though, that these studies be done. Seems as though the anti-inflammatory nature of the GLP-1 drug allow it to have wide-ranging effects on almost every organ system in the body. So it's important to know the short-term and long-term consequences of use of these wonder drugs. Let's go to the next article. It's an interesting approach in which following up patients with a protocol for bronchiolitis. I think both of my children had bronchiolitis before they were 5, and uh, required bronchodilators, but not steroids. And so this new effort in which they follow up patients has reduced the steroid rates to from 7% to 1% in some of these patients, as well as decreasing bronchodilator use. Long term, bronchiolitis in the pediatric population can often result in asthma and lower respiratory problems in adult life. And so the management of this problem when they're very young becomes very important. And the fact that you could go from steroid use from 7% to 1% is very attractive, and bronchodilator from 24% to 11% is impressive. So uh, it's good to see these treatments that affect the pediatric population that will keep them so they will be healthy as they age. I don't know how many of you have had children or grandchildren with bronchiolitis who then turn into asthma and those kinds of things, but it's important to have it treated early on.
Yes, Dr. Calendar. A couple questions. One, steroids. Can you just uh, explain what they are, and albuterol in particular? Can you say anything about those?
Okay, albuterol is a bronchial dilator. So people have bronchiolitis, that means the bronchial tubes are inflamed and so they can't breathe. Albuterol is a drug that is used to dilate the bronchus so that they can breathe. Steroids are medication, prednisone and Cyclophosphamide and Cymedrol, are drugs that are anti-inflammatory, and they decrease the swelling in the bronchial tubes and therefore allow the patient to breathe better. And so when you have a protocol which reduces the reliance on these bronchodilators so that they can breathe better and negate the need for steroids so that the bronchial tubes enable the child to breathe become very important. Uh, you'd like not to need bronchial dilators, but asthmatics or people who have bronchiolitis, if they can't breathe better, they die. And so uh, this protocol, which would decrease the reliance on the bronchodilators, allowing them to breathe, and the steroids, which would allow them to breathe, it become very important in terms of their long-term survival. Does that help you at all?
Well, my question goes back to the title of this. Why would they cut albuterol on steroid if it helps the
Well,
children?
that's the point. They don't need them anymore.
Oh,
Yeah, in other words, with this treatment, they don't need them anymore. Uh, uh, that's what that's about. That they don't need them anymore. Uh, so any treatment that would reduce the reliance on these dilators and steroids is good because it means that they don't need to use the albuterol, which is a bronchodilator, or need to be on steroids, which reduces the inflammation. So this means that this protocol that they're using is successful, and they therefore don't need the bronchodilators and all the steroids to reduce the inflammation that is part and parcel of bronchiolitis. In many ways, bronchiolitis is a predecessor for asthma. And so to decrease or eliminate this in children, that means a reduction of asthma in the older children and adults.
Okay, so I understand that they want to cut albuterol and steroids, but what are they doing instead of that? That
They're following up the patients. They
uh,
have a protocol in which they actually follow up the patients, and uh, they get feedback, and they uh, trying to identify ways in which uh, they have a standardized treatment. But they don't go into the details of the standardized treatment here. But the standardized treatment they use uh, decreases the need for the albuterol and the steroids.
okay,
And if you can't breathe and you're wheezing and you're short of breath, these are the symptoms of a bronchiolitis.
thank you.
Any other comments or questions about this study that, and we people of color have a increase in the number of asthma and atopic uh, diseases like bronchial asthma. So this is important for us. Okay, let's go to the next article. This is a strange article which looks at the so-called lucid dreaming, which is somewhere between waking up and being unconscious. And they talk about the ability with lucid dreaming to impact what's going on in your dream as you between unconscious and conscious. I'm not sure uh, how it manifests itself in terms of us as we dream and have daydreaming and night dreaming, but it does allege that with the so-called lucid dreaming that you can uh, impact whatever's happening to you in your dream. Because in your dream, you may be flying, you may be, who knows what you're doing. But they say that this is an actual state that exists that they confirm by electroencephalograms and brainwave testing that actually exists and is different from a dreaming, which you may have no control of, whereas this lucid dreaming, you may be able to control your activities. Uh, and they compare this to the way people act when they have psychedelic drugs. Uh, and, the way people behave, of course, that's problematic in itself because the things that they do on psychedelic drugs is almost beyond the comprehension. Um, but anyway, this is what lucid dreaming, they say, is important for the psychological and psychiatric community. I think it's pretty premature to really do anything other than to say that there is a state that exists between sleeping and wakefulness, and this in between step is called lucid dreaming, in which this state you have some control over your dream. I don't know.
Dr. Calendar, what about what category does out of body experiences fall into?
I don't I don't know. Well, it seemed to me an out of body experience is dreaming, whereas the because you don't have any ability to control what happens out of body. But lucid dreaming, you have ability to control, so it would be separate from out of body. Out of body, you're out of body, so you're just watching what's going on, but you don't control anything. Whereas lucid dreaming, you have some degree of control.
Thank you.
Darryl has his hand raised, Doctor.
Okay, Darryl. Can't see any hands. So.
Okay. When you say so-called lucid dreaming, from my point of view, I lucid dream about a couple times every month, usually around a full moon. And I've been lucid dreaming for, um, let's see, since I was in my 30s. So I do have some experience with it. Um, yeah, out of body dreams, they can be either lucid dreams or non-lucid or regular dreams. Um, yeah, but out of body experience can be a lucid dream. The whole key to a lucid dream is that if you are aware that you're dreaming and you take control of your dream, then it becomes a lucid dream. But at some point in your dream, it has to trigger and you have to maintain the focus that I am dreaming. From that standpoint, the control that you take, it could be limited, it could have a wide range of control. Um, it's up to the experience and the expertise of the dreamer. Uh, but yeah, it's very accurate that it's not the awake state that you experience when you're during normal everyday life. It's not dreaming. You do have control. A typical dream is like being in a boat on an ocean. The dream takes you. In lucid dreaming, you take the dream according to various levels, but it really depends on how long and how able you are to maintain focus that you are dreaming. When you lose focus that you're dreaming, it turns into a normal dream.
Most of the out of body experiences have not been associated with control. Uh, and most of the out of body experiences that people report, they seem to report them, but not have the ability to do anything about their out of body experience.
Yeah, yeah, most. I've had an outer body experience where I floated up to the ceiling. I saw myself laying in bed. The time was verifiable. I could see the clock on the nightstand. Um, yeah, so yeah, most but not all. It out of body experience, from my experience, can very definitely be a lucid dream.
Thank you for sharing, Darryl. Thank you. Any other comments?
Yes, I too have experienced lucid dreaming, and I can probably remember maybe 5 or 6 different times. I swear when I woke up that I could get back to that state where I was flying. I could fly. I could leave my bed and fly around. I'm serious. I felt exactly, and I could control where I was going. And
Thanks for sharing, John.
yeah, in college, a lot of psychedelics were available. I I I don't think it had a lot to do with that, even though the psychedelics put you in a different framework of a different relationship with your conscience. So yeah, I felt, and I wanted to get back to that. I really did want to be able to
I co
travel.
I co-sign everything John just said.
But I do have a couple of questions. Precunious and ayahuasca. Those are words I haven't seen before. Do you know anything about those?
No, I do not.
Right, precunious.
No, I don't know. I I don't know where the precuneus is. That's in the brain, but I don't know where it is. Some part of the brain, but I don't know which one. What's the other one?
Uh, Ayahuasca.
Oh,
It's probably a kind of a
oh, that's some kind of drug. I don't know. I know about LSD, but I don't know about ayahuasca. Yeah.
okie dokie. Thanks.
Yeah. All right. We got time for one more article, I guess, if there's one more.
And
This is an interesting article about nasal spray being recalled because of mold. As you know, we have so many nasal sprays now. Uh, we even have for epinephrine and many others. But this is a special nasal spray that's a reboost nasal spray that is supposed to relieve congestion and sinus pressure. But this drug apparently uh, is associated with mold. I'm not familiar with any of you familiar with this nasal spray that's used for congestion.
never seen it.
But anyway, it looks like they recalled it because it was associated with mold. But it's the only nasal spray that I know of that. Yeast, mold, and microbial contamination, uh, so that people actually got sick. So I don't know. It's a homeopathic nasal spray for respiratory congestion. So just to alert everybody's attention. So if you're using it, stop.
Well, what does that homeopathic mean? Natural? Is that natural?
Yeah, well, yeah, yeah. It means that you use it because you want to, uh, not because the doctor prescribed it per se. So you probably can get it over the counter, but I'm not familiar with it at all. Okay, I guess that's the last article for us. Interesting articles today.